Unit 4, Biological Psychology. Presentation 7, Psychological Methods of Stress Management.
Because stress can have serious negative health implications, stress management has become big business. Approaches such as relaxation and meditation can help reduce many of the symptoms of stress. However, many experts believe that the only really effective techniques are those that either train people to think about stressful situations differently or those that increase a person's resistance to the negative effects of stress.
The first psychological method we're going to look at is one that trains people to think about stressful situations in a more positive way. Stress inoculation training, developed by Don Meekenbaum in the 1980s, is a form of cognitive behavioural therapy. Cognitive behavioural therapies change the problematic thoughts and beliefs a person may have about a stressful event, and also change their way of responding to it.
Stress inoculation training. Meekenbaum believed that it would be impossible to get rid of all the stresses in a person's life. However, it is possible to change the way they think about them and react to them. He coined the term inoculation training to describe how a person could be protected against a stressor before it actually arises, so that when it does arise, the person won't be stressed by it. Stress inoculation therapy doesn't involve a vaccine, but instead gives the individual a set of skills and ways of thinking about stressful situations so that should they come into contact with such a situation in the future, they will be able to resist it. There are 3 phases in this form of therapy. Let's go through them. The first phase is the conceptualization phase. In this phase of treatment, clients are taught to think differently about stressors they might face. They are encouraged to view potentially stressful events as problems to be solved, and to identify those aspects of their reactions to these events that are potentially changeable and those that are not. The second phase is referred to as the skills acquisition phase. In this phase, the client is taught coping skills that can then be practiced, first in the therapist's office and then later in real life. These skills might include problem-solving skills, interpersonal skills, and making use of social support systems. The skills taught are tailored to the specific stresses that clients may have to deal with. The final phase is referred to as the application and follow-through phase. The newly acquired coping skills can then be applied in increasingly stressful situations. Various techniques can be used, including imagining how they would deal with a specific stressor, watching someone else deal with the stressor, and role-playing, in which they act out scenes involving that stressor. In order to further consolidate these skills, clients may even be asked to help others with similar problems. Booster sessions are offered later on to provide further support. Evaluation of stress inoculation training. A strength of stress inoculation is that it has been shown to be effective as a way of helping people deal with stressful situations. For example, Meekenbaum compared stress inoculation training with systematic desensitization therapy to deal with the fear associated with a fear of snakes. Both treatments were successful in reducing the fear associated with snakes, but there was an added benefit for the stress inoculation group. Their therapy also enabled them to deal with a second, as yet untreated phobia.
They could simply use the same sort of skills to inoculate themselves against other phobias.
Stress inoculation training isn't just effective for clinical conditions such as phobias, but can also help students overcome the stress associated with academic study. Sheehy and Horan gave first-year law students 4 weekly sessions of stress inoculation training, each session lasting 90 minutes. These students subsequently showed lower levels of stress and anxiety about their studies and, most significantly, improved upon their predicted grades. This shows that when people unwittingly respond to stress with irrational thoughts and actions, they don't perform as well. Stress inoculation helps to get rid of these and replace them with more constructive thoughts that help us to deal with future stressors more effectively.
Stress inoculation training has been criticised as being too time-consuming as a method of stress management. In most cases, stress inoculation training consists of between 8 and 15 sessions, plus follow-up sessions over a 3 to 12-month period. It is, therefore, a fairly lengthy form of treatment. However, Meekenbaum has also demonstrated the effectiveness of relatively brief periods of therapy. For example, for victims of sexual assault or when people have to undergo surgery. Even stress inoculation interventions as short as 20 minutes when preparing patients for surgery have proved to be effective in reducing stress levels.
Our second psychological method of stress management is hardiness training. Suzanne Kobassa and Salvatore Maddi first identified a personality type that was especially resistant to stress. They called this the hardy personality.
Kobassa and Maddi believed that hardiness was learned rather than inborn. Therefore, people could be trained in hardiness in order to help them manage their stress better. The aim of hardiness training is to increase a person's self-confidence and to give them a sense of self-control so they no longer feel overwhelmed by stressful events in their life.
As with stress inoculation training, hardiness training involves 3 phases. The first of these is focusing. The client is taught to focus on the things that cause stress in their life and to recognise the physiological signs of stress, such as an increased heart rate or muscle tension.
The second phase is to relive stress encounters. The client is encouraged to relive stressful situations they have encountered in the past. They are then encouraged to analyse how they responded to them and whether their responses were effective at relieving the stress.
The third phase is self-improvement. The insight gained from the previous phase about what was and what wasn't effective at relieving stress can then be used to move forward and learn new techniques. For example, stresses can be seen as challenges that the person can take control of and overcome rather than problems they must give in to.
Evaluating hardiness training. Hardiness training works. Hardiness training has been shown to be effective with many different populations. These include helping at-risk students with stresses faced during college life through to increasing commitment to training in British international swimmers. Hardiness training was successfully employed prior to the 2008 Olympics in Beijing to ensure that swimmers were committed to the challenge of stepping up their performance and to controlling stressful aspects of their daily life that might otherwise interfere with their training regime.
An important application of hardiness training is to help in the rehabilitation of military personnel injured in combat. A growing number of military personnel are experiencing and surviving devastating physical and psychological injuries as a result of their deployment in countries such as Afghanistan and Iraq. Meekenbaum predicted that stress inoculation training and hardiness training would provide these people with the motivation and skills to decrease the likelihood of disorders such as post-traumatic stress and depression. It would also enable them to deal positively with their physical disabilities.